We are committed to helping families rebound in Kansas City, and for many, that means preparing to go back to school, right? In a one-on-one interview, the top doctor in Kansas said the problem isn't necessarily resuming in-class activities. It's increased community spread and people not following CDC guidelines, but he says there is hope. The top health official in the state of Kansas with more than 40 years experience. He's also a military veteran fighting this war with data, a stethoscope, and a mask instead of a flak jacket.
I just come back in 2018 from a Middle East deployment where I started in 2017. And I came back and I said, well, I'm deploying to Topeka, you know, and it feels just the battle rhythm, it just never ends.
As we march towards slowing the spread of COVID-19, Dr. Norman sat with me to discuss schools reopening, mass gatherings, and to separate fact from fiction. You look at all the mandates or suggestions that we stay away from bars, that we stay away from mass gatherings, even prisoners and people in jail, they're trying to come out early due to COVID-19. Yet we are going to start school in session, in class soon. Break down the logic to me with that.
It's a tough one. You know, we do need to get kids back in school, or at least back becoming educated. And I think if we've learned that schools are much more than just about teaching and learning, but it's also the fabric of our society. It's nutrition, it's socialization, it's mental health. So it's a delicate balance, but the practices put in place, what we call engineering adjustments, meaning where are desks, where are chairs, how is air handled, how close, how far, masks or no mask, all those things work. The trouble is that people don't practice those kind of safety measures with great regularity.
Let's suppose a classmate or even a teacher in that classroom tests positive for that matter. A lot of parents are concerned. What should they do? What should they know?
If somebody tests positive for it, it's the obligation that the parents know what's going on.
Dr. Norman says it's the district's responsibility to notify anyone who's come into contact with someone who tests positive. Earlier in this pandemic, Dr. Norman's adult son tested positive for COVID-19. How's your son, by the way?
He's well. Matter of fact, it's his birthday today. He got over it. He was really sick for 15 days with it, and but he's young and resilient, and he did well. So, yeah, it's just touched my family, too.
Suppose you were the parents of small school-age children right now. Would you feel safely sending them back to school?
I think I would if I saw the plan and could engage in the dialogue with the teachers and with the administration, and I could go kick the tires on the place and say, yeah, this makes sense to me.
A plan each district is comprising as we speak. Dr. Norman says if we're devoted to following CDC guidelines for just 28 days, it would make a world of difference, although those guidelines have changed.
Vice Admiral Jerome Adams, our U.S. Surgeon General, himself asthmatic and a very brittle asthmatic as a kid, has come out very strongly supporting the use of masks.
Clear this up for me, though, because in March, Jerome Adams said the exact opposite. A lot of leaders said the exact opposite. We don't need masks right now.
I think a couple things. One is there weren't enough masks, and anybody that was wearing a mask that really wasn't at the highest risk was depriving somebody in a medical setting, a first responder, et cetera. We didn't know how wildly infectious this is. You know, and you've seen those sneezing videos and everything, pretty dramatic.
Testing is up nationwide, like 40% nationwide, and a lot of people think case counts are up because testing is up. Break that down to me.
It seems logical, but it is not true. And the reason is, with increasing testing, if the number of positive cases really out there were either leveled off or dropping, then the percentage of positive tests would drop down to very low numbers. But as we're doing more testing, the percentage of positive tests are going up. We get smarter every day, but we don't know everything about this virus. And they constantly learn. We often hear medical experts talk about a second wave of COVID-19 in the fall. Dr. Norman says it's important to note there could also be a third and a fourth wave and so on and so forth. A lot of it depends on wearing a mask, social distancing, and a possible vaccine, amongst other things, to help slow the spread.